What is COVID-19? Somebody tell me. Go ahead, brother.
COVID-19 is a virus that can spread really easily.
Okay, COVID-19 is a virus that can spread really easily. Now, we often call viruses or bacteria germs, right? Now, viruses and bacteria both can get inside your body. And they can do good things, especially a bacteria can do good things inside your body, such as help you digest food, etc. But also, there are bad types of bacteria that can get in and cause infections. Has anybody here ever had a sinus infection? You have? Okay, if you ever had a sinus infection, man, you can even get sick at your stomach, and you usually have to take antibiotics. Antibiotics are drugs like penicillin and things like that. Antibiotics will help you build up antibodies that will fight against bacteria, okay? Now, a virus, though, is different than bacteria. A virus, there is no cure. If you get a virus, that virus has to run its course. For example, has anyone ever had the 24-hour virus? Have you had that? What happened to you when you had that virus?
I got sick and I couldn't just stop it.
Couldn't stop throwing up, right? I mean, that virus, man, it racked your body, but it only lasted for about 24 hours. That's why they call it the 24-hour virus. A virus, once it gets in your body, it must run its course. Another example of a virus, it has no cure, is the cold. If you've ever had a cold with the sniffles and the cough and run a little bit of fever, a cold is also a virus. Did you know that? And what happens is that cold has to run its course. Now, a doctor may give you cough medicine, may give you some throat lozenges, but you cannot cure the virus. You can only treat the symptoms. I might can give you medicine that'll make you feel better, but it's not going to get rid of the virus, okay? Because the virus must run its course. And so a common cold, that virus is going to last in your body about 7 to 10 days. The COVID-19 is also a virus, so there is no cure for this virus. Does anybody have any idea how a mild case of COVID-19, about how long it's going to last in your body? Yes.
If it's very serious, it can last almost forever until you die.
It can kill you, right? But you know what? Even a flu, the normal flu can kill certain people, right? Especially if they have a weak immune system or something like that. So what happens with the COVID-19 is normally it's going to last a week to 14 days. In other words, you may have a sore throat, you may have a stuffy, dry cough, you may have some other symptoms with that. Now, we can treat those symptoms like we do with the cold, but if it becomes a serious case where you can't breathe and things like that, then you're hospitalized, okay? But the virus many times doesn't kill you. Most of the time it doesn't. As a matter of fact, over 90% of the time, really over 98% of the time, you're going to be okay. Most people don't even go to the hospital with it. Most people just quarantine for about 14 days. Then after they're through with the quarantine, they're back out in the public, okay? That's because the virus has run its course. And so you're usually tested a couple times. If your test comes back negative, then you're clean, you're out, you can go back out into the public. Now, years ago, there was a virus that was going around that was called, that carried with it smallpox. And it carried with it, there was another virus that was polio. And this was actually killing kids, man. Smallpox was killing kids. Polio was rampant, and kids weren't able to walk, and it was destroying lives. And so what happened was they came up with what's called a vaccine. Even though there's no cure for a virus, if they can create a vaccine, what that does is it's like it gives you a small amount of a disease in order to build up antibodies in your body so that when the big disease comes along, then you don't get it, right? In other words, your body rejects that virus. So for example, smallpox, what they did was they found out that kids that had chicken pox, if I'm not mistaken, if they had chicken pox, weren't getting smallpox. Now chicken pox wasn't deadly. And so what they were doing is they were infecting kids with a small dose of chicken pox. And even though they would break out a little bit, they would not get the smallpox, which was deadly, okay? And so that's what a vaccine does. A vaccine gives you a small dose of a disease that builds up antibodies in your system so that you won't get the full-blown case. Now, right now, there's a lot of pharmaceutical companies that are very close, they believe, to creating a vaccine for COVID-19. Wouldn't that be nice? If we could create a vaccine for COVID-19, then those who take it would be immune to it, hopefully, and maybe we could get life back to normal. Now, if you remember, before you started school, most of you had to show your shot records. Now, you may not have known that, but your parents had to bring shot records up here, and you had certain vaccines that you had already taken so that you would not get smallpox, polio, and some of the other diseases that a virus would carry along with it. So, does that kind of help you a little bit understand what COVID-19 is? Now, what are some ways that we can prevent from getting COVID-19? Because like I said, once you get the virus, it's there. It's got to run its course. So what we're trying to do is we're trying to prevent you from getting COVID-19. So what's some of the ways we can do? Yes.
Wear a mask, stay away from each other.
Wear a mask like this. I've got my mask. Wear a mask. What's another way we can
Wash your hands for 20 seconds.
Wash your hands for 30 seconds. I'm glad he put that in there for 30 seconds. We'll talk about that in just a minute. What's some other ways that we can help prevent getting COVID-19? Yes.
Use hand sanitizer.
Use hand sanitizer. Keeping our hands clean. What's another way? Any way else? There's something you're doing in here right now. What are you doing?
Stay 6 feet apart.
Stand 6 feet apart. You are social distancing. So in other words, we're trying to stay away from each other, not getting too close to each other. We're trying to do away with the hugs, the handshakes, the kisses on the jaw. We're trying to stay away from each other because if somebody else has it and we get close to them, the COVID-19 lingers in the air for a little while. And since the COVID-19 virus lingers in the air, we wear masks and we try to stay away from each other. Also, the COVID-19 virus can live on objects. For example, it can live on desktops. And so we want to sanitize the desktops. We want to sanitize our computers. We want to make sure that we're not touching things that other people have touched. What is something we may touch that other people touch? Go.
These desks.
These desks. Okay, somebody may sit in that desk beside you. What's something else we may touch that other people touch? What?
School food.
School food, maybe, but it should be your own food. What's something else?
Doorknobs.
There we go. Doorknobs. Everybody touches the same doorknob, man. And when you go in the bathroom, everybody touches the same faucets, right? Unless you got an automatic on and off. Everybody touches the same toilet flusher. So they're objects that everybody touches. And so therefore, it's very, very important that when you touch an object, that you wash your hands immediately before you touch your face. Everybody in here is wearing the same thing today. Everybody's wearing the same thing. It's not a mask, because I'm not wearing a mask right now, but I'm wearing the same thing you are. Guess what that is?
Shoes.
Huh?
Shoes.
Shoes? Okay, what if I took my shoes off? What's everybody still wearing? Everybody wears this all the time, 24/7. What are you always wearing?
Skin.
Skin! Everybody's wearing skin, man. And so you see, a virus cannot get inside your body through your skin. So a virus has to find a hole in your body in order to get into your body. Now, on my face, there are several holes that I got. Got a hole right here, I got a hole right here, I got a hole right here, and I got a hole right here in my eyes. You say, I don't see no hole in your eyes. Well, they're there. For example, if you're watching during the summertime and you're sitting and you're looking through a window and you see the sunbeams coming through the window, have you ever noticed all them things floating in the air? You know what I'm saying? Like, it's dust. It's floating in there. Now, so is dust floating in the air right now?
Yes.
Yes. We just don't have a sunbeam showing it, illuminating those dust particles. But the same particles you see when you watch the sun come through a window and you see them floating in there, they're right here, right now. We still see them. And guess where they're going? They're going up our nose. They're going in our mouth. They're going even in our eyes. And so what happens is your eyes have tear ducts in them. And every time you blink, it washes your eyes. Do you know that? Even though you're not crying, even though it doesn't look like you're crying, every time you shut your eyes, tears begin to flow over your eyes, and that washes the dust particles out of your eyes so that you can see. And so, have you ever noticed that when you get something in your eye, what's the first thing you want to do? Shut your eye, because you want to clear it out with those tear ducts. And then you may want to rub it, because you rubbing it makes the tear ducts, makes the tears flow even harder. And if you got something in your eye very long, what happens? Tears begin to roll down your cheek, doesn't it? Because you are producing so many tears to try to wash your eyes out. Because you have tear ducts in your eyes, there's holes there that go inside your body. So therefore, if I touch an object that's got any virus on it, and then I rub my eyes, then it can get in my body. If I do not wash my hands and I eat food and I've already got the virus on my hand, see, as long as that virus is on my hand, it can't hurt me. It will never hurt me. Somebody could paste my whole hand with coronavirus liquid, right? It's never going to hurt me. It's not going to hurt me until I get it inside my body. So if my hands are dirty and I got coronavirus on my hands and I eat, then when I put that food in my hand, the virus is going to go from my hand to my food, from my food to my mouth, from my mouth inside my body. Now I have the coronavirus. So there's a lot of ways that we can get it inside our body, because the coronavirus or any virus is invisible. It is so small that you have to have a very, very strong microscope to even see a virus.